let's stand and say the Pledge of Allegiance together. Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. So if we could have approval of the orders of the day. Well, I'm going to call meeting to order first. Let me do that. Call the meeting to order. If we could have approval of the orders of the day.
So moved. Second.
Hearing a motion and a second. All those in favor, please say yes.
Yes.
Opposed? No, motion carries. Thank you very much. Next order is approval of the minutes of the meeting of February 21st, 2014.
Second.
We have a motion and a second. All those in favor, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you very much. And now, Dr. Von Waldner's going to introduce Dr. Seaman, whom we're very pleased to have with us today.
Thank you, Madam Chairman. I'm very pleased to introduce this month's speaker, Dr. Joe Seaman. After attending the University of Cincinnati for college, Dr. Seaman attended medical school at Wright State University. He then returned to the University of Cincinnati for his internal medicine residency and pulmonary medicine and critical care fellowships. During his spare time there, he also obtained an MBA from the University of Cincinnati. Widely published, his current clinical interests revolve around bronchoscopic and interventional techniques related to the diagnosis and management of lung cancer. He is also interested in healthcare delivery and systems, and we look forward to his future participation in medical staff leadership here at Sarasota Memorial Hospital. Therefore, without further delay, please welcome Dr. Joe Seaman and his presentation on interventional pulmonology.
Thank you, Dr. Roswell.
I'd like to thank the board as well as the community for letting me come today and speak about interventional pulmonary. Thank you, Dr. Van Walder, for the nice introduction. Interventional pulmonary is sort of an offshoot of pulmonary medicine, largely revolving around the utility of the bronchoscope or other tools to aid in the diagnosis and or management of lung problems or lung diseases. There are really two main focuses. It's either a diagnostic intervention or a therapeutic intervention. And today I'm going to give you a few examples of each of those. Two advanced diagnostic interventions that we have available to us here at Sarasota Memorial are endobronchial ultrasound, an ultrasound device that's applied into the bronchial tubes, as well as a navigation technology, which I'll show you a photo of here in a minute. Endobronchial ultrasound, as depicted here, is a small probe that's on the end of a bronchoscope that we insert into people's airways through their mouth. What that allows us to do is to see beyond the bronchial wall. You see a piece of flesh, but you can see beyond that. In this upper tile on the right, you see a section through the middle of a chest with blood vessels as well as some soft tissue density beside a bronchial tube. The ultrasound probe is inserted into the airway, applied to the bronchial wall, which then allows us to see the soft tissue density on the other side. This happens to be a lymph node. A port, aside from the ultrasound device, allows a needle to be inserted into the soft tissue, seen here by the white line. That needle then samples that soft tissue density and helps us diagnose, in this case, malignancy that's spread to the lymph nodes. Previously, this type of lesion could not be biopsied, anything short of open surgery. Another modality is navigation technology. Today's technology with CAT scans, we're able to extract information from the CAT scan to build a map of a person's chest, much like an individual would do if they pull up a map on their phone or on their TomTom device in their car. We then identify an area of interest in the chest, perhaps a nodule or a mass, and that acts as our address. The device then tells us what route to follow to that address and allows us to biopsy that address. Here we see a very busy tile with 6 different photos. The first photo is the conventional CAT scan image that one would see if a CAT scan was ordered. The other renderings are composite photos, maps made of the original CAT scan. After putting in the desired address, a purple line is then generated as the route which we should follow. We then follow that route with our small locatable devices, and allows us to reach the desired location. Here's a typical image that we see when we do a biopsy. Here's the bronchoscope. Protruding from the end of the bronchoscope is what we call the locatable guide, or the little device that tells us where we're at in the chest. And that's how we know we can biopsy a specific spot in the chest. This technology can then be taken further, and we can place small, what we call fiducial markers in the chest, which allows for an individual to target, say, stereotactic radiation to a small lesion or abnormality in the chest in somebody who could not undergo lung surgery to treat their cancer. Moving on to advanced therapeutic interventions. Therapeutic interventions revolve around the alleviation of symptoms a person may have because of their disease process. Things that we do here include endobronchial ablative techniques, removing tissue from an individual's airway stenting, providing a mechanical opening where one was not available previously, and then now using heat energy to treat asthma. I'm going to present a brief case involving a patient who had had a cough for 2 months and had progressive shortness of breath. Over a period of 1 day, she developed severe shortness of breath and was unable to breathe, and 911 was called. She was brought to the emergency room where she had this chest x-ray showing the left chest to be of normal aeration and normal configuration, but the right chest to be opacified. This is her CAT scan demonstrating a normal left chest with air in the lung, but the right lung had a very small amount of air in it with a very large tumor in the center. This area should be an open bronchial tube as it is here, but we can see that there's a large tumor occluding her airway. Her month's worth of symptoms was this tumor growing in her airway, but over a period of a few hours it occluded her airway and she became very winded and short of breath. We then utilized a series of tools to recannulate her airway, which is seen here. Further in the lungs, there were open bronchial tubes to her right middle lung and her right lower lung. Unfortunately, where the tumor was situated, it provided a significant amount of compression, and therefore we were unable to keep her lung open for a long period of time. We had to proceed with placing a metallic stent into her airway to keep her airway open. This photo here demonstrates the bronchoscope coming into her lungs and a metallic cage holding her bronchial tube open. The tile in the lower left demonstrates this metallic cage, also known as a stent, with a camera sitting just above it. Here's the same patient with a camera now protruding through the stent, showing her open airways. She was able to be discharged a few days later and proceeded to have treatment for her cancer, notably not on oxygen and feeling better. The last interventional technique that I'll present to you today is for asthma. The photo depicted here is the Alair bronchial thermoplasty machine. This is utilized to intervene on patients who have asthma with symptoms. This new technology involves inserting this metal probe into the lung through the bronchoscope and applying the heat energy from the probe directly to the bronchial wall. What this does is it reduces the amount of smooth muscle. The smooth muscle in a bronchial wall is implicated in the role in asthma. Folks have constricted bronchial tubes, they wheeze, and feel shortness of breath. This system applies heat energy to the bronchial wall, thereby reducing the amount of smooth muscle. Their symptoms are alleviated and, generally speaking, do very well. The landmark study looking at this looked at the symptoms related to their asthma, such as severe exacerbations, those requiring them to go to the hospital, those requiring them to go to their doctor to get treatments. Those were all reduced over a period of 5 years. That's something that's going to be coming soon to Sarasota Memorial. I'd be happy to entertain any questions after the presentation.
Any questions for Dr. Seaman? Thank you so much. We appreciate your coming.
Welcome.
I think our next is, our Excel Award winner is Dottie Barfield.
No. Our Excel recipient for the month of March is Dottie Barfield. Dottie is a health information technician. She's been an employee of Sarasota Memorial since April of 1989. Always dependable and always smiling are just a few words from coworkers and staff that make up the nominations for this longtime excellent employee. Here are a few comments. An SMH old-timer of 25 years, Dottie is a prime example of an employee who continually goes above and beyond expectations. Whatever the task, whether it be her normal job duties or helping her fellow peers, physicians, or customers, she gives it her utmost attention without complaint or question. Dottie is a true leader in the HIM department. Dottie puts her heart and soul into transcription. She strives for excellence with this very important part of the patient's medical record. She has great rapport with the physicians and transcription vendors. Dottie is always pleasant. She answers all questions expeditiously. This puts a smile on your face when she answers the phone because you know she will find the answer. Dottie is never too busy to assist. She helps us avoid surgical delays and is one of the best pre-op's greatest resources. Dottie is a dedicated student who studies hard to excel at her job. I'm very proud of her for continuing her education and being a full-time coworker, student, wife, and mom. I always know that whatever medical record issues a physician might have, once I involve Dottie, it will be resolved professionally and with a smile. Dottie has come to the physician's lounge at a moment's notice to help a physician get his or her job done right away, which leads to great patient care. She's an extreme asset to the whole hospital, period. Dottie participates and contributes to various community charity events such as American Cancer Society Relay for Life, American Heart Association, and Mothers Helping Mothers. There are many examples of Dottie going out of her way for the benefit of someone else. She does this often. Congratulations, Dottie.
You better have a conversation with your coworkers. An old timer?
This is the XL program, an employee recognition program of Sarasota Memorial Healthcare System. The hospital board and administrative staff of Sarasota Memorial Healthcare System are grateful to all employees who constantly enhance the quality of a patient's stay by making an extra effort in their daily activities. The XL program is designed to recognize employees who have distinguished themselves by prior performance and attention to others. Individuals recognized are models of excellence who strengthen the quality of patient care and the image of Sarasota Memorial Healthcare System in the community. The hospital board and administrative staff are pleased to present to you, Dottie, the Excel Award for March of 2014 in recognition of your demonstrated courteous and caring attitude and contributions toward excellence at Sarasota Memorial Healthcare System. Signed by Quinn McKenzie, Chief Executive Officer, and Marguerite Malone, Chairman of the Board. Congratulations.
I work for a great team. I'm just a small part of it. So,
This is a great part of it.
this is fantastic.
Doesn't sound small.
Yeah, thank you.
Thanks, you.
And now,
Okay, great.
okay. Thank you very much. And now the leader of the year, Kiva Russell, Manager, Health Information Management, the same group.
There must be something going on in HIM. The recipient of Sarasota Memorial's Leader of the Year for 2013 is Kiva Russell. Kiva has been an employee of Sarasota Memorial since June of 2011. She's currently a manager in Health Information Management. Here are a few comments from her nominations. Kiva displays leadership excellence in the performance of her duties by not only focusing on the job at hand, but focusing on the positive. In our team meetings, she always includes a portion that focuses on what's going well. She strives to make it important for her team to focus on their successes and achievements and not just areas of improvement. Kiva takes the time to listen to our comments and concerns, then acknowledges them, creating a much more positive working environment. She takes the time to know one's job description so she's familiar when addressing situations. She does a lot of team-building exercises in meetings to help our group work better together. Kiva displays a professional image every day and stresses the importance of being punctual, organized, and presentable at all times. She's a woman that any person would admire and respect. Kiva is leader with a heart. She's very understanding when it comes to others' personal situations and is very helpful and offers great advice. She's polite and considerate at all times. Kiva has volunteered on numerous occasions for Sarasota Memorial as well as the community. She is just a wonderful person. Thank you, Kiva, and congratulations.
I'm truly honored, and I echo Dottie's comments, and I'll continue to do my best every day.
Congratulations. And next, our Employee of the Year, Heike Buchan.
Hello. On your day off, I understand. Heike Buchan is the Excel Employee of the Year for 2013. Heike has been an employee of Sarasota Memorial since January of 1985. She is a nurse in the neonatal intensive care unit. An outstanding resource, excellent skills, and a natural leader are just some of the words used to describe Heike. Here are a few highlights from comments from her nominations. Heike was selected by her peers as a core charge nurse for the NICU. She's an NRP instructor, certified lactation counselor, credentialed by the NCC, and lead of the PIC nurse team for the NICU and pediatric units. She's always the first to try new equipment or change practice based on evidence. She was a member of the NICU Unit Practice Council for several years. Heike was a core person in the development of the NICU SCM flow sheets. She currently participates on the NCA BSI project, as well as developed a feeding protocol for premature babies that was approved by the neonatologists and initiated into practice. Heike is effective with the staff in the charge nurse role. She communicates well with the NICU staff so their roles and responsibilities are known. She always has a smile and keeps a positive attitude. Heike has excellent skills and knowledge. She is great in anticipating critical situations. She is grace under fire. She remains calm even when she's the primary resuscitator for a 24-week premature baby. Heike has a natural leadership character, and on multiple occasions, she's been a liaison of sorts for the different healthcare professionals that work in the unit. Heike orients the new staff to the SCM computer system. She's an awesome resource and offers help in addition to all of her other responsibilities. Heike is someone who sees the whole picture and is able to adjust her decisions accordingly. She's always upbeat and energetic. She gives our babies and families outstanding care. She's truly a joy to work with. Heike consistently receives numerous kudos via patient satisfaction surveys, discharge follow-up calls, and stargrams. Heike is a tough act to follow, an excellent team player, and a great person. Congratulations.
Thank you very much.
Introduce your son.
Well, thank you very much. It was a great honor to be nominated by my peers for the Year Award. And I also want to just say that it's only possible to be excellent if you work in a unit in a hospital that's excellent. And I feel all the staff is very much supported in our unit to do their very, very best. And I'm very fortunate. Yeah.
Congratulations, Heike. And now for the report of the medical staff, Dr. Von Waldner, Chief of Staff.
Thank you, Madam Chair. It's been a busy month for the medical staff, and so we have 4 items of action for the board. The first is the approval of amendments to the medical staff organization manual, adding the interdisciplinary care committee and the utilization review committee. The medical staff was informed of the formation of these committees and had an opportunity to comment according to the medical staff organization manual. The MEC then approved the committees and recommend your approval.
I move approval of the amendments to the Medical Staff Organizational Manual, adding the Interdisciplinary Care Committee and the Utilization Review Committee as recommended by the Medical Executive Committee.
We have a motion and a second. Is there any discussion or any comments? Hearing none, all those in favor of the motion, please indicate by saying yes. Yes. Opposed? Motion carries. Thank you.
The second item is approval of criteria for privileging for clinical trial procedures. The criteria has been reviewed and approved by the Credentials Committee and approved by the Medical Executive Committee, which recommends your approval.
I move approval of the criteria for privileging for the IBV valve system and the Impact 24B implanted neurostimulator and the MiraClip implant clinical trials as recommended by the Medical Executive Committee.
We have a motion and a second. Are there any comments or questions? Hearing none, all those in favor of the motion, please indicate by saying yes. Opposed? Motion carries. Thank you very much.
The third item is approval of privileging criteria for the surgical ablation procedures. This criteria has been reviewed and approved by the Credentials Committee as well as the Medical Executive Committee, which recommends your approval.
I move approval of the privileging criteria for minimally invasive surgical ablation procedures as recommended by the Medical Executive Committee.
We have a motion and a second. Are there any comments or questions? Hearing none, all those in favor, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you very much.
The final item is approval of privileging criteria for the single-site robotic surgery. Again, this criteria has been reviewed and approved by the Credentials Committee and approved by the Medical Executive Committee.
I move approval of the privileging criteria for single-site robotic surgery as recommended by the Medical Executive Committee.
We have a motion and a second. Are there any questions or discussion? If not, all those in favor, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you very much.
And that concludes my report.
Thank you very much, Dr. Wumbolder. And Robert Dutrell is ill and not able to be with us today, so we'll move on to the Secretary's report, as Alex Quarles is not here today either.
Thank you, Madam Chairman. I have the April board meeting scheduled. On Thursday, the 3rd of April, at 7:30 is the board breakfast. At 8:30, the Quality Committee meets. At 9:30, Mission and Planning meets. At 10:30, the Governance Committee meets. And at 11:30, the Audit Committee meets. And then again on Monday, the 21st, at 1 o'clock, we have the public board meeting. That's my report, Madam Chairman.
Thank you very much, Mr. Towler. We'll move on to the Treasurer's report. Mr. DiVirgilio.
Charity care for the month January. I move approval of the bad debt and charity care for the month ending January 31st, 2014 in the amount of $12,661,000.
Second.
This is my mistake, and I'm terribly sorry, but it's actually for the month ended February 28th.
Okay.
I did the motion wrong.
I will amend my motion appropriately to say it's for February 28th, 2014.
Thank you, and the second is okay with that. Any comments or discussion?
I think we ought to rebuke Carol Ann.
Yes, a public flogging. Sorry, friends.
Well, if there's no comment or any discussion, then all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you very much, Mr. DiVirgilio. And now to the operations report. First up, Mr. Wojcik, our Chief Financial Officer.
Thank you, Madam Chair. I have the financial highlights for February 2014. This is 5 months into our fiscal year. And our operating revenue for the system for the month of February, $46,224,000, compared to a forecast of $46,785,000. For our fiscal year to date, operating revenue stands at $228,147,000, compared to a forecast of $226,035,000. For the system total expenses for the month of February, $45,057,000, compared to a forecast of $45,753,000. For fiscal year to date, total expenses of $227,990,000, compared to a forecast of $227,562,000. The operating income in the rating agency format for the system for the month of February, $3,539,000, compared to a forecast of $3,362,000. Our operating margin for the month, 7.1%, compared to a forecast of 6.7%. Fiscal year to date, operating income of $12,194,000, compared to an operating margin, which results in an operating margin of 5%. And this compares favorably to the forecast of $10,089,000, or an operating margin of 4.1%. For the hospital's paid hours for adjusted admission for the month of February, 122, a little bit lower than last year's 125. For the fiscal year to date, we stand at 124, which is the same as last fiscal year to date. The average daily occupancy, 396 patients, 38 of which were observation, compared to a forecast of 380, and we expected 44 in observation. These are fiscal year-to-date numbers. Admissions, 12,015, compared to a forecast of 10,949. Our average length of stay so far this year, 4.5 on average, compared to last year, 4.68. The hospital's surgery cases, February year-to-date, 8,070, compared to a forecast of 8,277. And so far this fiscal year, we've had 1,232 births, compared to a forecast of 1,146. Our outpatient registrations through 5 months of the fiscal year, 168,849, compared to a forecast of 176,318. And our emergency care center registrations, fiscal year to date, 45,005, compared to a forecast of 42,010. The hospital's case mix index for all patients stands at 1.63 so far this fiscal year, and for Medicare patients, 1.77. Madam Chair, that concludes my report unless there's any
Thank you very
questions.
much, Mr. Rojan. And now, Ms. Jan Mock, our Chief Nursing Officer.
Thank you, Madam Chair. Welcome to the board and to the community. Today I want to spend my time recognizing some of our great leaders who are sharing their best practices with our nation and actually the world. First, I'd like to recognize Stacy Scott Berteau, Director of Volunteer Services, and Janet Steves. They are both in attendance. If I could have them stand. Last week, actually Saturday, they presented at a national American Organization of Nurse Executive conference on the topic of volunteer resources, engagement with nursing, new models with measurable outcomes, improving patient care. Their talk was basically throughout the country. As we all know, volunteers are becoming more engaged and involved in how they can help support nursing and other professionals in providing positive, measurable outcomes for our patients. The session highlighted programs collaborating with nursing leadership through support of patient flow, fall prevention, and patient satisfaction. Focused on the sharing of program development of assessment tools, and measurable results gained from these programs. I want to thank both of them for their partnership, their collaboration in improving patient care through the use of 2 separate programs that meet patient outcomes. Thank you, Stacy and Janet. I had pictures I would have showed them to you, but they were a little dark, so I didn't think you'd be able to see them. But we have proof of their great representation of our organization and their work. Second, I'd like to recognize Deb Harmon, the manager of the NICU and neonatal transport, Dana Pico, the educator in the NICU, and Sarah Singh, who's a pharmacist. I think, again, you'll see the collaboration that we have amongst our team members as we work towards the best outcomes for the patients. Deb and Dana are going on an international trip to Portugal for the international conference sponsored by Connect All, who we partnered with to help us connect our NICU monitors for our tiniest babies with our Volt system, so that when something goes off abnormal, something happening with the monitor goes off, it sends that message to their Volt, so they immediately get that response. As we moved into the new courtyard tower, they went from one big room, or fishbowl as I call it, to private rooms, and this really guarantees that safety. The other thing, just for the community and you all to be aware of, is one of the new patient safety goals is on alarm fatigue. We have so many alarms in hospitals that people get fatigued to all these different alarms, and so that's one of the national patient safety goals. And they will also be talking about alarm fatigue as they present this. So I'd like Deb and Dana to stand. Dana, is this your first trip out of the country? No. Okay, well, she's a traveler, but this is Deb Harmon, so she's pretty excited. So we want to congratulate them for representing us in Portugal. The other one is we have Dana and Sarah, who are going to the Academy of Neonatal Nurses Advanced Practice Conference in Hawaii. How did you all pick these great places? To present their great work and extensive data that we have on leading successful interventions with neonatal abstinence syndrome. As we all know, the nation is having a problem with new babies being born addicted to drugs, and we see that in this area. And with our physicians, our pharmacy colleagues, our nurses, and the community, we have been really addressing this and have put interventions in place that are making a difference with the outcomes of our babies, their length of stay, and they will be sharing this data, this extensive data that the pharmacy has collected on what we're doing that we can share with our colleagues throughout the country. So I want to thank you. Is Sarah here? No. Okay, she couldn't make it. Thank you all very much. You will be known all over the world. The next is we will be sponsoring 2 China nurses. Through our partnership with Becton Dickinson B&D, as you know, we've worked with them on several other projects, quality projects. We were asked by Beijing University, the director of nursing, to have 2 of the nursing managers come here to observe the things that we're doing in this hospital that are very well represented of quality outcomes. Their objectives are to learn emergency nursing care. One of them is a manager in the emergency room, and the other one is a manager for an eye floor. And they're going to learn nursing care in the emergency room and infusion management, to understand the quality management experience in the USA, to understand the training programs that our nurses have available for them to advance their professional development, the methodology and the format, observation, exchange, and clinical practice through what we expect and anticipate in the actual nursing workforce. And SMH will also get their ideas about how they deliver care in China healthcare system and the integration of nursing. They have participated in 2 other exchange programs in the U.S. at Mason University and Michigan University, which are both teaching organizations. So we feel very privileged to have this program in our organization. It took a whole village to get this coordinated, and so I want to thank Jean Lucas for her coordination of that, and Patty Reynolds, who will be housing these nurses as they are here for a month. So we'll be sharing their experiences with you and what they've learned from us and what we've learned from them. So we look forward to them. And the last thing I just got today is we got word that our hospital received the Get With the Guidelines Stroke Gold Plus Quality Achievement Award for implementing specific quality improvement measures outlined by the American Heart Association and the American Stroke Association for treatment of stroke patients. Get With the Guidelines Stroke helps hospital team provide the most up-to-date research-based guidelines with the goal of speeding recovery and reducing death and disability to stroke. We also received the association's targeted stroke honor roll for meeting stroke quality measures that reduce the time between hospital arrival and treatment for the clotbuster TPA, the only drug approved by the U.S. Food and Drug Administration to treat ischemic stroke. We are dedicated to improving the quality of stroke care by the American Heart Association and American Stroke. By using these Get With the Guidelines, stroke helps us achieve that goal. And with this award, our hospital demonstrates our commitment to ensure that our patients receive care based on internationally respected guidelines. I want to thank Agnes Kelly and her team for helping us achieve this, but it really takes all disciplines working together to get this award and these outcomes that we're so pleased with. And that ends my report.
Thank you
Good
very
St.
much.
Patty's Day.
We do have a very quick board report, and I'm going to give it. It has to do with our trip to Tallahassee on March 10th and 11th. 4 of the top executives and 2 board members went on that. And our interests are always in promoting the need for Medicaid expansion. There are 65,000 people in this area, and if we were to have Medicaid expansion, 30,000 of them would be assisted. So we go to talk to all the legislators on that topic. We also talked to them about the way the monies for Medicaid will be dispersed. There are some changes happening. Managed care is going to be providing the money, and then there's a new system for distributing it, which has some areas of concern for us, so we shared that with the legislators. And thirdly, although we are not a trauma center, we are very, very interested that there be quality trauma delivery and treatment for all the folks in our area. And so we always then, when we go up to talk to the legislators, share our views about the importance of that and the fact that it's very critical to have really top-notch quality trauma care. And of course, we actually provide very comprehensive care here ourselves, a lot of which would qualify as trauma, but we are not a trauma center. It takes our best medical input and administrative input is that it really takes a large number of cases for a institution to be at the top of their game. We have been very, very well served in the past by Bayfront and Tampa General, and so we feel there's not a need, has not been a need in the past for us to do that. But we talk to the legislators because it's very important that there be quality trauma care for all the folks around. So we spent 2 days, talked with our delegation, a number of other folks, and had a productive visit, and are going to have another one with 3 board members and probably 4 administrative staff here in another couple of weeks. So that concludes that report, and we are moving on now to committee reports, and we begin with the Finance Committee. Mr. Richard Merritt, Chairman.
Thank you, Madam Chairman. The Finance Committee met on March 6th. Bill Wojin discussed the proposed solution for the main plaza office space. Sarasota Memorial will not be renewing the lease and will put those employees into space we own. 35% of the employees will go to Bee Ridge, 35% will go to the Hillview property, and 30% will be included in the main campus final moves. Bill discussed the prior approvals at the Bee Ridge Urgent Care site, the 1852 Hillview site, and the final moves budget here at the hospital. Therefore, I move the approval of the relocation of funds for the main plaza project to facilitate moves to the Bee Ridge, Hillview, and main campus locations in the amount of $5,575,000 as recommended by the Finance Committee.
We have a motion and a second. Any questions or discussion? Hearing none, all those who are in favor, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you.
Bill Wojin then discussed the Series 2009 A bonds, which created the funding for our courtyard tower. He described that we have optional call rights of $11.884 million of the bonds, which are callable at par value on or after July 1st of this year. Bill reported that calling the bonds would result in a reduction of interest expense of $651,000. They have an interest rate of 5.5%, which is significantly higher than our current average cost of capital of 3.19% year-to-date as of January 31st, 2014. Therefore, I approve the redemption of $11,845,000 of the district's Series 2009 A bonds on July 1st, 2014, as recommended by the Finance Committee.
All those, are there any comments or discussion? Hearing none, all those in favor of the motion to approve said items, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you very much.
We then had a revenue cycle update from Steve Rhodes. Steve reviewed the 2013 accomplishments, fiscal year 13 collections, commercial recoveries and denials, actions taken which included reorganizing the leadership team, enhancing scripting, providing auto draftability, billing advocacy, improving the abandoned call rate, expanding interdepartmental communication, creating lead lists, reducing vendor payments, and having a new early out and secondary collection. And it was quite an interesting presentation, and we still have a lot of work to do. And they're doing a great job over there, and they'll continue to do it. Nelson Lane then advised the SMH about the SMH retirement plan funded level has improved substantially and is projected to improve further over the next 10 years. including estimates for implementation of new government accounting standards for pension plans and using current actuarial assumptions. The plan is now funded at 81% as of September 30th, 2013. The plan is expected to increase to 93% funded at 2023. Plan expenses are projected to decrease from $23 million in 2013 to $6 million in 2023, which puts our retirement plan among the top retirement plans in the entire nation, let alone the hospital industry. So that concludes my report.
Thank you very much, Mr. Merritt. And we move on to the Quality Committee. Mr. Robert Strasser, Chairman.
Thank you, Madam Chair. As you know, the Quality Committee's meetings are held in a closed session, so consequently, I have nothing to report.
Thank you very much. So we'll move on to the President's report. Ms. Gwen McKenzie, President and CEO.
Bill. This is our organization report card, fiscal year to date 2014. We're now almost halfway through the year. You've seen this many times, and this is also our report to the community in the pillars. So in our patient experience service pillar, we have HCAHPS at 7 at the 50th percentile of CMS average, and we're looking to get to 9, which is the goal. On the outpatient side, for our 850,000 outpatient encounters, we're looking for an overall patient experience rating of 83%, up from last year. Currently, we're running year-to-date 81%. Our Gallup employee survey has yet to be done. We'll be conducting that in later April, early May. So that's to be determined, and we're looking for a score of 4.26 out of 5. The merits on time is a joint commission requirement. We're currently at 98% against the goal of 95%, so we're exceeding the goal. In the quality pillar, we have several different measures. The first is value-based purchasing, which is a compilation of Centers for Medicare and Medicaid measures of quality, and we look for those to be at 100%. We're currently at 99.8%. Our organization percent of patient safety readiness are our audits, interviews, and rounding that take place monthly throughout the organization. We're looking at 95% readiness in the event that we had any type of survey, and we're currently scoring 99%. Infection prevention is a combination of 3 different infection rates, and we're looking for the combination of those 3 to be at a standardized rate less than 1. Currently, we're at 1.09, so we have a little work to be done there. Organizational finances, Bill reported today. Our budget is 4.2%, and our forecast for this time through the end of the year is 4.6%, so we're currently exceeding our percent operating margin. The growth pillar on the inpatient side, this is our busy time of year, and so we are exceeding our growth goal of over 25,000 admissions. We've got over 26,000 admissions, as you heard Bill talk about. And our outpatient registrations, budgeted to be 812,000, we're currently just shy of 800,000. With that, a little bit of the detail. This is the HCAHPS, or Hospital Consumer Assessment of Healthcare Providers and Systems. The domains are the groupings of questions in 9 different areas. This is what we're looking for to be 9 at the 50th percentile, and you can see for each quarter we're at 7, including January, February. You can see the areas that we're falling a little short of the mark: communication about medications, quietness, and discharge information. So we're currently doing a full court press in those areas. On the outpatient side, this is February as a month, not year to date, and we did extremely well in a very busy month. Our actual performance was 84th percentile in Press Ganey for patient experience, and you can see everyone who was above the 50th, above the 83rd, and then below the 50th, which requires special attention. And we were at the 84th percentile overall. So that means year-to-date for October through February, we're at 81% with the performance of the same areas that you saw in the previous slide. This is the family that has visited us for 7 years in a row. They visit on Valentine's Day, the parents and 2 children, and bring gifts and joy to the children in the pediatric unit. So we saw them again this year, Jim and Susan and Alexandra and Nick. We had the closing ceremony for Black History Month, and Bill was kind enough to be the executive who was part of that ceremony, and you can see our Hall of Fame inductees. That's Brian Bird, who's a patient transporter, Jacqueline Carter, who's a phlebotomy tech, Norma Limehouse, who's a phlebotomy tech, and Katina Wilcox, who's an oncology care coordinator. So we're very proud of them. We also found, not to our surprise because she's extremely talented, that Kelly Munch, who is our manager of the Institute for Advanced Medicine, received the American College of Healthcare Executives Regent Award. So we're very proud of her. She serves on the board of the ACHE in the local area here and is a fellow. This is about Dr. Russell Sampson, who is over on the right-hand side there. He's a vascular surgeon on our staff, and he not only had a feature article that was published in this publication of the Society of Vascular Surgery, but he's also the editor of this particular journal. This was our Women in Medicine event. This was Dr. Andrew von Eisenbach, who's on the left-hand side, and our own Dr. Kirk Volker, and our own Dr. Jim Schumacher was also part of this setting of about probably 300 to 400 people attended this Women's in Medicine luncheon, and it was about the whole research progress and process over the years. Dr. von Eisenbach was the leader of the FDA, the Food and Drug Administration, so he described to the audience how a drug tracks through the investigational process to FDA approval, and it was very interesting. Is that thunder? Okay. Everybody okay? We've heard enough about the leprechauns. All right, so this is going to be exciting. This is one day, March 28th. We have Dr. Mehmet Oz here. Dr. Oz is the host of the Dr. Oz Show, but he's going to be talking about women's health, prevention of cardiac disease, and proper nutrition. And just as a background for our community, I know the board knows, but the community may not remember that we have an affiliation agreement with Columbia University. That's where Dr. Oz, who's a heart surgeon, is on staff. So this is part of our Columbia agreement. Not only will Dr. Oz be here, and he'll be speaking that afternoon, but the very next day, we have a cardiac symposium that's also open to the public that will be a compilation of both our physicians and Columbia University physicians talking about cardiac disease. So that'll be an exciting 2 days. And I believe there still are tickets available for the Friday event. This is our quality safety pillar. And as you can see, we're up to November through the Centers for Medicare and Medicaid. This is national benchmark data. And you can see we're doing quite well with the green, but we need to have every single category here in green. You can see the areas that we missed. The prophylactic antibiotic, we missed by 1 patient out of 51. But nonetheless, these are the quality rankings, and we need to be perfect. So that's what we're working on. Dr. Carey notified us that he has been named to the Leadership Council of the American Urological Association. This is no surprise, but he's quite accomplished, and we're very proud of him. This is a very prestigious position, and he has actually videocast some of his surgical procedures to their national meeting because he's quite innovative in his approaches in robotic surgery. So we're very proud of him and proud to feature him. And then Mr. Carter was there, but the new pedestrian bridge arrived not in the middle of the night, but practically because traffic had to be shut down. This is a pretty large bridge to be on a truck, coming up I-40 or US 41. So this bridge was placed through the Medical Arts Building there on the right over to the south parking garage on the left. And now we're shoring up those connections and completing. We haven't used the bridge yet, I don't believe, but we will be in the near future here. But it was quite a project for this crane. We had to close down the road, and of course this was quite late. So, in order to minimize patient traffic, it was quite a procedure to make sure all was safe. But it was well done, and we now have a bridge. Not open for operation, but we will soon. And that concludes my report.
Thank you very much. Nothing on the consent agenda. And do we have any public comments?
No public comments.
No public comments. Move to legal matters. Ms. Caroline Kalish.
I have no report.
Okay. Any other business to be brought before this body? Seeing none, we are now adjourned.